Thank you very much today for your time. My name is Stephen Chung, a physiotherapist from Hong Kong. Today, we would like to share a new perspective of a well-understood concept to you, from the body core stability to the foot core system. If you are dealing with treatment, rehab, and injury prevention, especially for runners, you are in the right webinar. Many experts agree running is one of the easiest available options during COVID. We see more and more people have started running, and there are so many running clinics, professional trainers for runners, and running events across all ages and around the globe. There is a huge and soaring market for running. Here is an article from a professional runner, Hong Kong. People has been investing on body composition analysis, body symmetry scanning, and even gait analysis. In the result, people are spending a lot even before start running. Forget about all the lab, MRI, and body composition tests, and go back to the basic, the foot. By strengthening the underdeveloped sporting muscles group, you can be recalibrated into Olympic standard body symmetry. Today, I would like to take this opportunity to share a concept of foot core, which is essential but always being overlooked in the past. Before we dive deep into foot core, let's have a review on the body core stability, which is the origin of the foot core system. Punjabi conceptualized the spinal stabilization system consists of three subsystems. The vertebrae, discs, and ligaments constitute the passive subsystem. All the muscles and tendons surrounding the spinal column that can apply forces to the spinal column constitute the active subsystem. The nerve and the central nervous system comprise the neural subsystem, which determines the requirements for the spinal stability by monitoring the various transducer signals and directs the active subsystem to provide the needed stability. The dysfunction of a component of any one of the subsystems may lead to clinical presentation. Runners are all well aware of the importance of body core. Hodges et al. In 2003 introduced body core stability, and he was studying the timing of trunk muscles in patients with chronic low back pain. Hodges concluded that two major focuses are addressed in core stability programs. First, motor control and muscle capacity. The whole point for body core training is to improve the effectiveness of agility and functional tasks without conscious thinking. This way, the brain has more capacity to improve agility and functional tasks, including running. McKeon et al. Proposed the foot core system as a new paradigm for understanding intrinsic foot muscles function based on Punjabi framework, integrating neural, active, and passive subsystems. Neural subsystem is about musculotendinous, ligamentous, and plantar cutaneous receptors. Passive subsystem is about bones and ligaments. Active subsystem is about intrinsic foot muscles as a local stabilizer and extrinsic foot muscle as a global movers. We all know the importance of foot arch, controlled by intrinsic and extrinsic muscles. Current standard treatment focuses mainly on the passive subsystem, and the intrinsic muscles and neural subsystem are largely ignored by clinicians and seldom addressed in rehab program because they are hard to train. If you are already training on body core, now the new paradigm is the foot core. Fourchet et al. From the Swiss Olympic Medical Center pointed out in 2016 that foot intrinsic muscles are often neglected by clinicians. This is because very hard to educate patients to understand and feel the precise activation of the intrinsic muscles. And patients find it very difficult to figure out how to do it or performed by trick movement. Everything comes from the foot. The intrinsic foot muscles play a key role in postural control and maintain balance by controlling the height of the medial longitudinal arch, MLA. Therefore, weaknesses in the active subsystem related to the MLA may lead to injuries and overuse conditions. For example, plantar fasciitis and Achilles tendinopathy, etc. They also found out that NMES is a promising strategy in order to support the MLA and control the pronation during running. Activating the right muscles for NMES is key, especially at the foot area with small muscles in layers. Therapists can use a motor point pen to find the precise motor point for the muscles. Then, NMES stimulation educates patients to understand the precise activation of the intrinsic foot muscles. With the NMES, the patient's cortical muscular pathway is primed for subsequent motor training. How does the NMES prime the neural and active subsystem? What is the mechanism behind? Fragnan et al. In 2018 pointed out, by superimposing NMES with functional training, we can facilitate the cortical plasticity of the corresponding region on the motor cortex and strengthen the connections between the receptors and the intrinsic muscles, so that patient's cortical muscular pathway is primed for subsequent motor training. Peripheral NMES can generate constant and adequate sensory input to increase cortical muscular excitability, activate the neural circuit, so that patients get the most out of the training. Fourchet et al. Study used a biphasic symmetrical regular wave pulsed waveform at 85 Hz, 4 seconds contraction, and 8 seconds active rest. They recommended an average of 9 to 12 NMES sections throughout 3 to 5 weeks. Begin in double leg stance and progress to single leg stance activities. They also recommended to integrate NMES for the intrinsic foot muscles in dynamic tasks like hopping, bouncing, or landing as soon as possible during the progression. The foot core system proposed by McKeon in 2015 well explains why NMES work well in Fourchet study. NMES works on the neural and active subsystem. By waking up those sleeping and underdeveloped intrinsic muscles. The sensory stimulation from NMES educates patients to understand the precise activation of the intrinsic foot muscles, rather than trying to figure out how to do it by themselves. Most importantly, several research showed the effect of a single NMES treatment lasted for 2 months. Therefore, it should be more on the neural subsystem. This further explains why motor control should be addressed in the first place before building muscle capacity. Now, patients can perform short foot exercise effectively, aiming to have isolated contraction of the plantar intrinsic muscles to pull the first metatarsal phalangeal joint towards the calcaneus as to elevate the arch, the foot domain. The conclusion of the two authors from the Swiss Olympic Medical Center is to prescribe NMES superimposed short foot exercise for treatment, rehab, and injury prevention for lower limbs. As a physiotherapist, when I first heard of the footcore, I only had this image in mind. But after practicing with NMES, I realized the key missing link, the neural system. We hope this webinar provides you some insights next time when you treat runners or the footcore system to become part of the lower limb management. Before you invest on fancy tools for running, go back to the basic, your foundation. Train the footcore. Thank you so much for your attention.